and you might get run over or knocked over by that dog, or grandkids or children. Our reflexes are not as sharp. We're not as quick as we used to be. So trying to prevent ourselves from falling forward, we'll catch ourselves and hit something, things like that. Certain medical conditions can cause our balance to be off. Medicines can cause that. So those are the things that we need to take in consideration. And like I talked about, age-related muscle loss, but that is something that we can help prevent or improve. Other causes, I already talked about medications, and it's not just prescribed medications, it's over-the-counter medications, it's herbal medications. Those are the things that can cause dizziness, unbalanced. They can make your blood pressure drop. They can make your blood pressure go up, and things like that. What about some safety hazards inside and outside the home that we haven't talked about already? Does anybody else know any of those? I talked about dogs. We talked about weather. Yes. Throw rugs. Yes. And I brought a rug as an example. So throw rugs can be very detrimental, but they're also very important for like getting out of the shower and things like that. We don't want to be on wet ground. So rugs are important, but they can also be very hazardous. Weather related causes. Here we have all types of weather: ice, rain, snow, and those kinds of things can make it very detrimental. We don't always have to go out and get the mail if there's ice on the driveway, right? We can wait a day to get that mail. Okay. Speak up if you have concerns about falling. You can talk to your doctor when you go in and see them. You can talk to your family, your kids, anyone that's going to help you get the necessary assistance that you can get. Talk to your doctor if you've fallen. What caused the fall? Maybe maybe you didn't. A lot of times the patients that come in say, I don't know what happened. I just fell. Maybe they tripped and they didn't realize it. But if you feel like you are injured to the point where you need to be seen in the emergency department, call 911 and come in by ambulance or have someone bring you in. We are there to check you out. Yes, we do have a wait occasionally, but we will see you. Okay. If you feel unsteady with walking or standing, what are some things you can do to help you with that you don't need a doctor for? Cane or a walker? Yeah, as long as you know how to use them appropriately. But yeah, you can buy those over the counter. I just bought my mom not too long ago a walking stick, for hiking. So when she goes to her grandkids' soccer games out in the middle of the soccer field, she has a little more stability. So you can buy things over the counter or off of Amazon, wherever you can get those too. You're afraid you might fall. Does anybody have a fear that they might fall or have fallen already and now have an increased fear of falling? I do. I fall all the time. So I have to think about it. What would happen? How can I injure myself? It is true. And the older we get and the more unstable we get, people's fear increases. And so that decreases them getting out and doing the things they enjoy. And we don't want that. We want you guys to live your lives fully. So we want to make sure that that fear is recognized and we get that taken care of. Review your medications with your doctor or your pharmacist, especially if it's a new medication you know nothing about or how it interacts with other medications, because there may be side effects you had no idea are happening. And sometimes, like if even a dose change can make differences in what and how you're feeling. Speak up. Talk about your health conditions, and if they can increase your chances of falling. Example, vertigo is something, or dizziness, another name for it. So that is something that can cause you to have falls because you go from sitting to standing and you get dizzy. Medications can cause that. Certain health conditions can cause that. So know what your health conditions are. Be aware of the side effects of some of them or what they can cause. Okay. Talk to your loved ones to see if they can help you prevent falls. Does anybody have anything at home that they could do to change to make it so that they don't have falls? Pick up your shoes. That's something we can do. But say you have your son or daughter, come to your house. What are some things that they might be able to help you with? One, if the weather's bad, I can drive and get them closer to the door. Things up too high, we can move them lower so that they're easier to reach and not stepping up on a step ladder. How many people have step ladders at home they use on a regular basis? Yes, yes, we need to be careful with those. What type of step ladder might be beneficial? One that has a handle on it versus just a step that you can fall off of. So those are things we need to talk about. Moving your items closer in the house to make it safer and easier. Okay. Maybe rearranging your kitchen or rearranging stuff in your bathroom so stuff isn't so high. Those are the things that you can get help with, especially if you can't reach it. We were just talking about how I have this at home and I use this to get stuff up high. I'm vertically challenged in some things. And so I don't always get up in a step ladder and I use this to get it, or I use a pair of cooking tongs to get it out. So we need to do those things. Oftentimes getting the step ladder out takes a lot more time than it is just reaching it. All right. Any questions so far? Stay active. This is how we prevent it. This is how we keep it from happening. We have to get out. We have to move. We have to do the exercises to stay healthy and stay strong. So for saying lighting. Lighting is so important. We have to be able to see where we're going. Everybody have a nightstand next to their bed to put their glasses on if need be, or reach things quickly. Yeah, that's important. We have a lot of people that are reaching for stuff and fall out of bed and hurt themselves. So having things close by, but not too close that you don't trip over it, and where you can see. Good. Lighting in the staircases, that's really important. Anybody else have anything? Anything online? Not yet. Where to start? What about our shoes? Are shoes important? Yeah. We want shoes that are not slip, you don't slide. You want shoes that stay on your feet. Yeah. I made the mistake. So I work in the emergency department. I have to go quickly up to other parts of the hospital when someone's coding or something like that. And I made the mistake of wearing shoes that fell off my feet, and it went down a whole flight of stairs behind me. So I wear tennis shoes now every day as I'm work so that I don't trip and fall. So it just kind of depends on what you're doing. If you're going to be out walking around, have those sensible shoes. If you're just going to be sitting there and you want to be able to take your shoes off, they need to be a little more comfortable and non-restrictive, but we want them to stay on your feet. How about the annual eye exam? Does everybody get those? Yeah. My vision changes every year. Get new glasses or new contacts every year as the older I get. And keep that updated eyewear. How many people have over-the-counter reading glasses? Yeah. Do they help? Do they hinder you sometimes? I couldn't walk in them because everything was farther away. That's why I had to go to bifocals. Yeah. And I want to be able to see what medications I'm giving everybody when I'm at work, right? Yes. Very true. Not everybody can handle it. So what do they do instead? One for reading and one for regular. Yep. Does it make it hard when you're doing certain activities? Yeah. Yeah. Vertigo. I have vertigo too, and it can be very difficult at times. Yes. Let's talk about one other thing. How many of you drove here? Motor vehicle crashes are our second leading cause of injury to older adults. And it's not the fact that they're getting into the accidents or causing accidents, or if someone else caused it, it's the injuries that happen. As we age, our bones are just not as strong as they used to be. So we tend to have more severe injuries, especially in our chest, bruising to our lungs, a broken rib, things like that. And that can be very detrimental and harder to get over. So as we age, we need to make sure that we're seatbelted in appropriately. The airbags are working. We drive with caution. We have car fit classes in Lawrence, Kansas, put on by the Senior Resource Center. Those car fit classes are amazing because they have a whole day of class and learning, and then they have you bring your car to a checkoff, and they can make sure that you're sitting in your car and you can see out of your mirrors correctly. Your lights are working appropriately, those kinds of things to help prevent further injury. Kind of why I already went over, older adults have an increased susceptibility to injuries, which can be very detrimental. We do have a tendency to get in a few more crashes, have a little bumps and bruises when we get in these accidents. We back into things we don't see as well, especially if our vision isn't great. With dizziness, or they start to have some medical condition, and those can cause some severe accidents. A lot of times when seniors come in with accidents, we don't know if it was a medical condition and then the accident, or accident and then the medical condition. So those are a lot of things we have to tease out when they come to the hospital. How do we prevent? Always wear seatbelts. Drive when conditions are best for you. I don't like driving in the rain because of previous, accident. And so rain is not my thing, but today it's not bad for me. But so if you feel comfortable driving in the rain and you're confident with that, that's fine. Now, when there's ice out on the roads, you need to be more careful. The last ice storm we had here in, I can't remember what month it was, we had so many patients check into the ER, all with broken bones from getting in and out of their cars or walking to their cars. So just be extra cautious with the weather, driving and walking in it. Obviously, don't drink and drive. As we get older, we don't tolerate alcohol as well. We don't metabolize it as quickly, and so it affects you more. And safety classes, you can take driver safety classes like I talked about, okay? So that is pretty much the entire PowerPoint. But I did want to go over a few things. We can talk about some safety issues. So everybody has a phone, correct? I have a nice long cord for my phone so that it stays charged and I can look at it. But if it's plugged into a wall and I'm walking around, what am I going to trip over? This cord, correct? So we need to be really careful with that. Even extension cords in our houses, we need to talk about those. How many people use extension cords for their lamps because their light isn't close enough? Is it in your walkway? Yeah, it is. Do you have carpet? Well, just coming here today, they have this Velcro thing that goes over the cable here. That's amazing. Are we good? Oh, I'm sorry. The thing was she has her rug over the light cord. Yeah. So, we talked about throw rugs. I have a bathroom rug here that has some grippies on the back of it, but it's not enough. It still moves. It's not going to move on the carpet, but when I had it at home on my wood floor, it moved a lot. And so it's still very slippery and can cause issues. So there's things out there that you can buy over the counter at your hardware stores called rug grippers. You can buy those and put them underneath those rugs if you absolutely have to have the rug. Anybody have anything like this under their rugs at home? Do they work? Good, good. Sometimes I see the ones that are full size and the rugs still move. So just make sure that those work well, okay? And they hold it in place. And then I don't know if they saw this earlier, but I love these. These can grab all kinds of stuff underneath the cabinets or up high. They're grippers, they're reachers. Everybody calls them different things. You can buy these at the hardware stores. Anybody else have one of these at home? Yeah, I use these to get my dog's balls out from underneath the cabinets. How many of you have pets? Do they ever trip you? Once in a while they get underneath your feet. Yeah. You'll run into them.
Dead on.
Okay.
22-pound cat.
Oh, wow.
So I broke my toe.
Small dog. Animals can you never know what they're going to do. They like to run under your feet. They like to jump on you and we don't want you to get knocked over. So animals, you need to take that in consideration. Anybody else can think of any hazards they have at home that they watch and are careful about? Anything online? Anybody has anything? What about our furniture? Slippery chairs, move around easily, things like that. Or when we go to a restaurant, we sit in a chair that slides. How many people have desk chairs that have rollers on them? Those move on you. Yeah. Good, good. Mine's on wood floors and moves a lot. So I got to be careful when I go to sit down. Okay. Anybody, Allison, can you think of anything that we might have?
Maybe some outdoor awareness of like coming up the steps. Are there railings or are they just steps?
Well, let's talk about if you have problems with using stairs. A lot of places have ramps. A lot of places don't have ramps. If doing a whole flight of stairs, for example, out of our last class we had, someone talked about the stairs at Allen Fieldhouse. Those are some skinny, long stairs. And so you've got to be careful. So that person says they always take the stairs that have the handrails up the middle. And sometimes they even have a person on the other side of them to make sure they get up and down safely, especially going down because they are a little bit steeper. So when you guys are going downstairs or upstairs, maybe have another option if possible. Use the elevator. Talk about the facility before you go, or look at the layout of a facility beforehand and make sure that you can get in the right door to get to that area where you can go up and down the stairs. Those who use devices like canes or walkers, stairs can be much more difficult. It's hard to get up and down those. So If you do start using canes and walkers, make sure you have that physical therapy and the education on how to use those when you're going up and down stairs. Because every time I send someone home with crutches from the ER, I do stair education because it's inevitable. They have a flight of stairs they have to go up and down when they have a broken bone, especially when their legs or ankles. Tripping over umbrellas, outside chairs, you know, that kind of thing. Outside rugs get blown around. So just be aware of your environment and what's going on and how to prevent that. We want you to be aware of your medical conditions and make sure that you don't get too dizzy when you go from sitting to standing. And if you do have that issue, take your time. There's no reason to rush, okay? Even if there's a fire in your house, you still have a little bit of time to get out the door rather than tripping and falling on your way out. So never rush, take your time. Even in the weather, take your time. We don't need to get anywhere emergently. We need to get there safely. Okay. Any questions so far? I talk really fast.
If you have questions, please raise your hand because we need to get a mic so people at home can also hear your question. And if anybody at home has a question, go ahead and type it in the chat. Let us know. We'll pass it on as well.
Everybody's aware of the resources here in Lawrence. I know you can go on to Parks and Rec and look at their classes that they have. I know some of the gyms that have pools have classes advertised. LMH has classes advertised for fall prevention, like the Tai Chi or the Matter of Balance classes. If you guys ever have questions, you know, you can reach out. I'm in the ER. Please, I'd prefer you not to be my patient. I'd prefer you to come to the classes. I'd rather not see your name in my trauma registry. I think that's everything I have. Thank you for your time. Have a good day and be safe driving home.
Okay, thank you. It doesn't appear there's any more questions, so these sessions are not required to go a certain length, and we all got a lot out of this, I think, in the time that it was. So thank you again for coming this evening, and we'll call it a wrap for this evening, and we'll see all of you at whatever next retirement boot camp event you decide to show up with. This Friday is fun and games here in the auditorium for those who want to come. So thank you very much, and we'll see you then. Bye-bye.